All right, let's begin with the lead story this evening. We've been tracking the COVID-19 very closely on the channel and on the India development debate for over a year now. And all of those who join the show regularly know that. We've been telling you that cases have been spiking, have been rising over the last few days. And that fear came to a head today as far as the markets are concerned. But let's look at what's happening in the ground. It's not just Maharashtra and Kerala where cases are rising, though a bulk of the cases are still coming there. We're seeing a rise in cases in Tamil Nadu, in Madhya Pradesh, in Chhattisgarh, in parts of Jammu as well. In fact, the daily new cases are the highest since the end of November. And a little bit of precautions have begun to be taken. Local restrictions, allowing people out for essential activities only between certain hours in some parts of Maharashtra. So it's a piecemeal, localized lockdown kind of approach as of now. But will this be enough, and can this spiral out? To speak on this, I'm joined now by Dr. Giridhar R Babu, the head of Lifecourse Epidemiology at PHFI. Dr. Shashank Joshi, Dean of Indian College of Physicians, is on the show. Anant Bhan, Global Health and Policy Expert, also joins us. Thank you to all of you for speaking with us today. Dr. Babu, let me start by getting your take. Are we seeing a second wave? Are we seeing new strains? What does the data so far point out to?
Yeah, good evening, Tamanna, and happy to be here on this show. I guess there is a lot of confounding by several factors to be able to say in clarity whether this is because of the newer strains. It's mainly because we do not have simply the evidence to suggest that all the clusters are linked to the newer strains. What we need is a robust genomic sequencing data that's matched to each of these clusters wherever we are seeing it, to say that this is mostly due to the newer strains. What is worrying is if the metros again start getting higher number of cases, and which we have already seen through several sero surveys that there is at least substantial threshold for population immunity in these metros. If they start getting more cases, that will be a different scenario, and probably that is the time when we need to revisit whether it is a second wave or it's going to be a reinfection in the same people, because these supposedly these strains are probable of immune escape. So that's the second set of worries which I'm not really sure. Finally, we do not know why only Maharashtra and Kerala are having these clusters. Kerala is explainable because most of the parts of the Kerala had susceptible pools, but Maharashtra, in the numbers that we are seeing, just to explain that this is spreading to rural is just not complete. Why is so many cases, whether it's linked to newer strains, we still need further investigation. Tamanna.
You know, Dr. Babu, that is the question. Is this just a Maharashtra and Kerala problem? Because Maharashtra and Kerala have been accounting for the bulk of cases, I would say, for the last several weeks now. And even as the numbers had gone down, Maharashtra and Kerala were accounting for 70-80% of the cases. But now you're seeing a spike in other states as well. And you're seeing other states, neighboring states, beginning to make their borders more stringent. Do you think this is the need of the hour, and is this pointing to a wider spread?
Yeah, so just to point out only Kerala and Maharashtra, because earlier outbreaks have been detected, we'll be actually doing disservice to these two states because they're doing well in terms of surveillance. Now, Punjab is also increasing in terms of cases, and probably there's in Chhattisgarh also. But in Karnataka or Andhra Pradesh, if you see, these states are vulnerable because they have sort of reached levels of declines after seeing the peaks. Now they have to be careful. So if the question is it warranted? With this virus, nobody knows what is the next phase going to be. Everybody thought Maharashtra has probably reached a threshold for population immunity, at least in all the urban areas. But that's not the case. So therefore, people are definitely having this fear what's going to happen. So these are precautionary measures, but this is not sufficient. What we need to do is in every state, we need to continue strong containment measures, which mean we need to identify these outbreaks as early as possible, and testing levels have to increase so that we'll be isolating most people who have symptoms. That is the only way we can contain the epidemic. On the other hand, all of us are probably not seeing the kind of COVID appropriate behavior we should be seeing. So I think that's also another issue that we need to take care. Before vaccination is going to be enhanced and at least the vulnerable are covered, we need to do these two C's, which are very important: containment, and also ensure that we are covering the testing properly.
Yeah. Dr. Shashank Joshi, we've been speaking over the last week or so, especially about cases in Maharashtra, and the numbers from Mumbai give a little hope today. They are below 800, and it's a slight drop in numbers from Mumbai. Are we seeing a more worrying situation in the interiors of Maharashtra, which so far had been more secure? Mumbai was the hotspot, the epicenter, and maybe Pune, etc. Now you're seeing Pune in a resurgence, and other areas, Amravati, Akola as well, with more and more cases. How do you describe this pattern?
So thank you, Tamanna. I think we have seen three heterogeneous clusters in Maharashtra. One is the geographies of Marathwada region and Vidarbha region, particularly Vidarbha region. These are low exposed regions in the past pandemic over the year, and they have suddenly seen a surge because particularly in Amravati, Akola, those areas, Nandurbar, Nanded, Nagpur, and probably there was a total lack of COVID inappropriate behavior was there, no masking, a lot of social gatherings. And mind you, just like Kerala, Maharashtra also had Gram Panchayat elections exactly a month back. So in the rural areas, there has been a lot of admixture and a lot of travel. So that is probably looking at it. What was an outlier was Amravati, because we had a test positivity rate there, which was probably a free case of 53%. And sometimes it was 40%, though the denominator was small. And there was a possibility of a strain, which the microbiology department of BJ Medical picked up a E384 strain in 4 cases, but that is being investigated. NIV and NCCS will have the final verdict on the genomic robustness. So that is the first part. And there is a possibility that it could be a both transmissible state, but it's a possibility, it needs confirmation. But there's nothing to get scared about. And that is why that area has been contained and partly locked out. The second is the Mumbai and Mumbai metropolitan region. The lifeline of Mumbai depends on the trains, and trains opened up from 20 lakh commuters, went to 35 lakh commuters. And overall, there has been an unlocking in Mumbai. And you have seen that there was a fall in the community testing compared to hospital testing. So obviously, as the testing spiraled up in Mumbai, the numbers went up in Mumbai. But the good thing was deaths were consistently at 2323. Deaths never lie. In a pandemic, you may test less and you will get less numbers. But the deaths don't lie. And the case fatality rate of Mumbai has been very low in the last 4 or 5 weeks. Consistently, we are not seeing our ICUs or critical care units being overburdened with work. And we still have enough and sufficient beds available there. So Mumbai probably is in a yellow signal. And I don't think there is any strain which is to be of any cause of concern. And it's a very containable situation there. And then is the rest of Maharashtra. In the rest of Maharashtra, it's in an in-between mode, like Pune, Nashik, Nagpur. They clearly are seeing a doubling and tripling and quadrupling of cases. And there have been a lot of weddings, social gatherings, lack of masking. We have recommended double masking and so on and so forth. So we are actually seeing 3 heterogeneous clusters, and each one of them need to get our basics right. We definitely need to ensure that we do our testing, tracing correctly. We need to do our counseling and information and education appropriately. And we need to take people with us. I think we cannot just blame people and say COVID fatigue has set in. I think we need to take them into confidence and move with it. I don't think lockdown is a solution at all. Containment is. The other thing, Tamanna, I want to highlight, and I would love to take opinions from Giridhar and Anant, who are good friends of mine, that very clearly, 1 year back, when the pandemic started, we were 2-3 months behind Europe and US. And it's exactly 1 year now that again, last year also it was Kerala and Maharashtra which started the first spots. Are we seeing something of a pattern which later on, after a couple of weeks or a couple of months, will be there in other geographies of India? And if that sort of a pattern is coming up of the so-called second wave, it's clearly a worrisome trend. And then we need to mask and vaccinate very aggressively. And I feel we have a window now. We have a window of opportunity to intervene aggressively. We have committed governments, both state and central governments are very committed to basically get over COVID. And I think on a war footing, both the center and central governments and the state governments should proactively act to stem and nip it in the bud. I still feel it's a yellow signal, and I think we should make it green and not yellow and red. And I think we have an opportunity. We should not miss this opportunity, both by masking and a larger vaccination program to the vulnerable group, as Giridhar rightly said. So I think we have an opportunity. We should not miss it. And of course, we need cooperation from people. People can't say COVID has gone. Particularly in the hinterlands of Maharashtra, that's what happened. Most people thought
no,
COVID...
that's a very, but they never thought it had come in the first place. I mean, a lot of people felt that there was never any COVID. So like you have vaccine hesitancy, you've had COVID hesitancy as well, even to this day. But I want to take forward the point that Dr. Joshi has made is, are we seeing a pattern similar to what's happening last year? Because Anant, at this point, what are people asking themselves? They are asking themselves, are we going to go through what we went through last year? Are we going to see a second wave which will spread beyond Kerala and Maharashtra, which were the worst hit even in the first wave? Will that then logically lead to some kind of restrictions or the other? Is another lockdown completely ruled out, having learnt what we now know after a year's experience?
Sure. Thank you, Tamanna, for having us. So you're absolutely right. You know, what we need to be watchful now for is patterns. And there are some patterns. Dr. Joshi excellently described the three sort of clusters within Maharashtra. And that is the kind of high quality tracking that we need to see. As Giri earlier also alluded to, this is the time to do genomic surveillance. This is the time to do high quality public health workups to try to find out where these cases are, what kind of clusters are developing, and contain them in the bud. We've had the advantage of almost 15 weeks where we had a steady decline in the number of cases, but now we've, over the last couple of weeks, started to see a resumption of an increase, which should worry us all. I mean, if we don't address it now, we could be potentially going down a pathway where this spread could get national, it could spread to other states, and that is not what we want as we head into the summer months again, because we've had this scenario last year, as Dr. Joshi said, and we want to reduce that possibility from happening. Now, vaccination is extremely important. It's already been started. We need to ramp that up. But at the same time, what is really, really going to be useful right now is just sound public health approaches. I don't think lockdown at a national level or even state level is certainly any kind of a solution. What is required is smart management at a local level. As and where we see clustering, we need to do containment aggressively and try to reduce the chances of this going statewide or nationwide. If we don't, then I think we could be in tough times over the weeks ahead.
The question really is, how far will this go? How far will this go, and at what point will we need to take emergency measures? Can we today sit and say that there is no question of a lockdown? I'm coming back with all of those details after a very short break. Stay with us. Welcome back. We're talking about COVID fears of a second wave, and whether a lockdown is avoidable this time around. Dr. Babu, let me come to you on that mood question. We all know now, and it has been well said, often said, that there needs to be greater amount of testing, that there needs to be clearer containment policies, and we've seen those aggressive policies being rolled out now, at least to some extent in Mumbai, Maharashtra, etc. The other question is that will we go back to the lockdown as a method of breaking the chain? And that really is the big fear, isn't it? Because as people have started acclimatizing to a new normal, businesses have started opening up again, everything is back on some sort of a track. No one really wants the next stage of lockdown. Do you think that there is a way to control any kind of increase without a lockdown? And at what level do you think policymakers will have to come and have some sort of a lockdown to break the chain?
Thank you, Tamanna. I think this is a very important question that every state will be considering now. In my personal opinion, based on the evidence, The only requirement for lockdown is when the health system is unable to cater to the severely sick and those who require intensive care or critical care, what we say. If we are able to manage the load of these people with severe illness and those who require critical care, I think a lockdown is not necessary. But the point here is we should be able to prevent as many people as possible in terms of having severe illness or requiring any critical care. In order to do that, containment, effective containment is the most important thing. So we know for now, for more than a year, symptomatic approach or syndromic approach is the most efficient way of identifying clusters very early on, especially if the testing is done very strictly by following the syndromic approach. The next thing is contact tracing. This has to be very, very important. And if these two are done on a very strict manner at every place, I think we will be able to identify the outbreaks as early as possible. By expanding testing, we will be isolating as many people as possible. And this is how some of the good performing cities have contained the outbreak. And this is the best way to break the transmission chain. A lockdown is necessary when just to reduce the overall reproductive number. And from my own point of view, even in the last year, lockdown was necessary because it gave India a lot of time to prepare in terms of all the logistics, resources, and that's how we could manage this well. We now know which treatment work. We know what kind of mechanisms work. This is not the time for a hasty decision for lockdown without exploring other options, without reviewing the containment measures.
Dr. Joshi, should we also look at aggressive vaccination as a way to beat back COVID? The difference between last year and this year is that last year we didn't have a vaccine. We didn't know how to deal with it. Our hospitals and our doctors were still figuring out this new menace, and we are much better equipped now. So even as we've been discussing how to direct vaccination, does it make sense to have more aggressive and wider base of vaccination in areas with higher numbers, in this case Maharashtra and Kerala?
Absolutely, Tamanna. We need to have an aggressive vaccination policy. There is no two ways about it. And I think the vulnerable group, the earlier we cover it and we upscale it in an exponential way, involving all sectors, public and private, as long as it is equitable. Mind you, the word equitable is very important because we do not want any hoarding or black marketing of this vaccination process. It has to be done in a very equitable and a mindful way. It is not an easy process. India is one of the fastest countries to vaccinate on planet Earth, and it has a very good legacy of vaccination programs in other spheres. So I think this is the right time to take off our vaccination program in the vulnerable groups in an exponential way. And I'm reasonably confident that the government of India will take it up. I think they will also need to empower the state governments and decentralize it to some extent, as long as the caveats and the SOPs are maintained and followed to the last T, whether they are in public or private space. And as long as it is done in an equitable and mindful way, we will be able to cover this whole 30 crore vulnerable population. We will save lives. As Giridhar very rightly said, that then we can do micro containment, lockdown measures may not be needed. And if we are able to get a critical mass of population-based immunity, it will definitely make a dent on the so-called impending second wave. So I'm very, very certain that this has to be done, and this is a window, and we should not miss this window. I think the initial teething times of vaccination are over. They have done a very careful study, and even then they have done a very good job with the healthcare space and the frontline workers. But now is the time to take off, particularly in the vulnerable population above 50 and below 50 with the comorbid population. If they can do that 27 crore right, I think it will go a long way in saving lives, reducing that case fatality rate. And I think it will definitely make an impact on the so-called potential second surge. I think we can beat it. We can conquer it. And I think vaccination is one of those tools. But let us not forget public health strategies. I don't think there is any substituting for testing and tracing. And also there is no substitute for masking, even if you vaccinate. And I know enough people who are vaccinated with one shot, some with two shots, some who have had COVID, some of them who have antibodies. masking is going to stay in 2021 and 2022. In fact, I would go to an extent, say double masking and with a little bit of distance and sanitization will always stay. So there is no substitute to COVID appropriate behavior. So even if there's vaccine, COVID appropriate behavior just can't go. And that's something which everybody needs to recognize and get it right.
Yeah. Anant, another theory and another thing that people are saying, experts are saying, is that target the vaccination better, not just geographically, as we just discussed, but even to those who have perhaps already got COVID once, may have higher antibodies. We also have a parallel sort of herd immunity developing. Do we need to now figure out how to target those who have lower immunity or no herd immunity or haven't got COVID even once?
Yeah, it's a possibility, but one also has to look at feasibility. If you're going to go around doing antibody testing to try to figure out what level of immunities people might have, that might just delay your vaccination because it also requires resources and effort. I think rather than that, you might just want to be more aggressive in the way you vaccinate and try to protect your vulnerable population. And I think that vulnerable population is now well defined based on our experience. And in fact, we already have a priority group waiting beyond health workers and frontline workers. We just haven't gotten started with reaching out to them. And the time to do that was yesterday. But from now on, at least let's try to get a strategy where we start that's fair. If there are vaccine doses available, these need to be rolled out to that priority population. And actually, quite honestly, of all the efforts that we talked about, one of the things which will be required is human resources. If you want to do good quality contact tracing, if you want to get the vaccine out, you need vaccinators. So, you need more boots on the ground, and that is what is efficient, management. And surveillance also requires you to have enough resources available. So as we talk about how we can prevent a lockdown and the financial implications of that, the time for investment in our health services and ensuring that there are adequate people who can carry out these functions is extremely important. I worry about the fact that if we keep talking lockdown language, it will be always misconstrued as the curfews and the policing. It is not about the smart public health approach, which is more focused on containment. Let's not convert it into another policing danda approach that, we had issues with that last time as well. What we now know from that and what we can do better is, I think, containment, which is focused on trying to reduce the spread of infection from any clusters which is there, and ensuring that we ramp up our testing where required, ensure that we get our vaccination strategy to be ambitious, and ensure that we have adequate doses available, and back that up with just enough human resources to reach out the vaccines to those who need it.
Absolutely, absolutely. It's no point repeating the mistakes that we made last year. We've learned a lot more, and hopefully this will get much better than it gets worse. It's an orange signal right now, as Dr. Joshi said on the panel. Let's turn it green before it turns red. Thank you so much to all of you for joining us on the big story that we're discussing this evening.